Welcome to Global Health Talks. I'm Michael Lesner, and I have the distinct privilege of having a conversation today with Howard Catton. Howard, since 2019, early 2019, has presided as CEO for the International Council of Nurses, which is obviously a global position. We're delighted to have you here, Howard. We're going to have an informal conversation with you. Because we're Global Health Talks, we sort of want to relate much of what you say to international application, which, that's in your DNA, in addition to being an RN originally. A little bit about Howard. For 10 years, he was policy head of the Royal College of Nursing in the UK. Like I said, he was selected to be the CEO of the International Council in February. Let me ask you, Howard, when you took this job in February 2019, I think most of the viewers can relate to the good old days of 2019. And since that point, I was getting engaged in late 2019, and I was in Thailand. So the world has changed just a little bit. And I want to ask you about, first, the contrast between taking this job, accepting this job, and sort of dealing with the classic view of nursing, and I've heard you speak to this before, versus the modern day reality of nursing. And then I will share a little story with you that I think will amuse you.
So Mike, firstly, delighted to be able to join you. I actually joined ICN in about 2017, director of nursing, and then became the CEO, as you say, in 2019. And when I left the UK and came to ICN, there were some friends and colleagues who said, I'm sure it'll be a great experience, Howard, but we know that you quite like, the buzz, the energy, the uncertainty that goes around working within the UK at the time. It may be a bit quieter. The international world moves a bit slower. How wrong anybody could have been, and as you say, thrust into the middle of this global pandemic. But for me, if we cannot demonstrate the value of the international organization representing 27 million nurses right the way around the world, if we cannot take this time to advance nursing, to see it in increased leadership positions, to advocate, yes, for health systems and health delivery, but some of the big economic, public policy, moral and ethical issues that are facing the profession at the moment, we should pack up and go home. And you're right, Mike. One of the things I wanted to do when I came into this role was to help to debunk some of the myths around the profession. People know about the care, the compassion of nurses. It's at its core. That's not gone away. But not as many people in 2019 knew about the courage, the bravery, the hugely challenging situation that nurses work within, the advanced technical skills that many of our nurses have, their leadership ability, the way in which nurses are working right the way across both health, social care, education, housing, right the way across our societies, our communities. And I think one of the things that the pandemic has done in a way that we couldn't have done at ICN, it has beamed pictures into people's homes night after night after night about the reality of modern day nursing. And I do think it started to shift some of those traditional attitudes, views, and beliefs. We've got a long way to go still, but I think that the pandemic has started that reimagining, revisioning, repositioning the reality of nursing.
That's so interesting, Howard. In 2017, I was invited by Stanford University to speak to a room filled with doctors, pretty much under the idea that here comes telemedicine and you better deal with it. And these doctors were completely resistant to telemedicine. And it was like they were looking at it as a fad. And ultimately, time told us telemedicine is probably somehow, somewhere going to play a very important role in medicine. Similarly, I will tell you a story. I have a very good friend who owns an IVIG company, does very, very well. And his primary job, he's an RN as well, but he's also the administrator of his company. He got a call from one of his nurse administrators, and she said, "You will not believe this, Paul." And I go, and Paul said, "What?" He said, "I'm looking out at the parking lot of our hospital," which I won't give it a name, but it was a big Midwestern primary hospital. And she said, "I'm looking out the window, and do you know what's happening?" Because, well, I'm sure you're going to tell me what's happening. The painters are out there and they're painting out the names of the doctors in the parking spaces, and they're repainting the names of the nurses and the nurse administrators. And he said, "I am now negotiating signing bonuses for my IVIG nurses." He said, I have never seen anything like this. And I said, "Well, you know what? Normally," because usually the pushback you get from doctors is, "Hey, you want to be a doctor?" I introduced McKesson's e-pharma initiative. And when they found out pharmacists were going to dispense information, half of them grumbled and said, "Hey, you want to dispense medical information? Take minimum of 12 years and go get your medical degree and get, and do that." A lot of grousing and whatever. Today, all of that has changed. And I look at nurses as more angels of mercy than they have ever been before. And advanced nursing roles, and particularly as we look to 2022 and what will be around us, these roles have taken scientific and political issues. At Global Health Talks, we are the most interested in creating international equity language. And I'm sure you think about this regularly too, and I'd be interested in your thoughts. First, react for me to the painting in the parking lot, and then talk with me a little bit about world equity for nurses.
So a couple of examples from me in terms of how the image is changing from popular culture. People will know the artist Banksy, and early on in the pandemic, a mural appeared at a hospital in the UK of a child with his toys, his Superman, his Batman toy in the bin, and the child in his hand was holding a doll which was a nurse. A very powerful image about having thrown away the superheroes, the traditional superheroes, and who the new superhero is. But let me give you another example from popular culture, because I bristle a little bit with the superhero analogy, because it can suggest that nurses in some way, if they're superheroes, they don't need basic protection, support, pay, PPE, vaccination's a huge issue. The Connor brothers, very famous quote and a picture of a nurse, and the quote I think is this: "There are no such thing as extraordinary people, just ordinary people doing extraordinary things." And again, I think that absolutely speaks to my point about, yes, the phenomenal work that nurses have done, but they've stepped up and done their job, and they are ordinary people doing extraordinary things. but often doing that against the most challenging and difficult of odds and situations. We went into this pandemic, Mike, globally, 6 million nurses short, 27 million nurses worldwide, 20% down. Can you imagine, can anybody listening imagine going to work 20% down and facing the most difficult, challenging issue that you're ever going to face at your work? Not for a day, not for a week, not for a month. We're still rolling 8 months on. You know, nurses have been in the eye of this storm that hasn't gone away for 18 months now. We simply, when we talk about the world was not prepared for the pandemic, the nursing story, I think, is emblematic of that lack of preparedness, our lack of investment support into the nursing profession. It shows us that, we, as I say, emblematic of the lack of preparedness for health systems, and that needs some hard investment in nursing education, in nursing jobs, nursing leadership. And a lot of people will listen and say, we would expect the representative from the International Council of Nurses to come on and make the case for investment in nursing. And I make no excuses, and I will absolutely do that. But I do it not just on the basis it's the right thing to do to strengthen our health systems, but I also do it because I think nursing, this speaks to your second point, many of the solutions to the challenges our health systems are facing, nurses have those solutions. We need to increase access to care to people often in remote and rural areas. We need to do it in an affordable and a sustainable way, but we need to make sure that it's safe and high quality. Advanced practice nurses, nurse-led models of care right the way around the world, from the outback in Australia to the nurse in the supermarket in the US. I could go on. Case studies are on our website, are providing those examples, but our health systems often don't fund them. And that's a fundamental issue in terms of having the solutions, showing the evidence of what nursing can do, but then needing to make sure that the design of the payment systems for health systems, not a very sexy topic for nurses particularly to talk about, but something that we do have to get into to make sure that there are the incentives and the payment for nurses to do that work.
Tell us about some of the psychological challenges that nurses are encountering now, both on site, treating patients, but also when they leave the clinical setting and they go home to their own families, their own children, they go out in public. I know I have some very, very dear NHS friends, that's been a big circular loop, but nobody's gloating in America because I'm sitting in California and Mu virus is starting to act up here again. So comment a little bit on some of the psychological ramifications of what you're seeing nurses go through. And do you see answers for that? Or is it just, hey, I saw a train wreck this morning and I have to get by it and maybe tomorrow's a better day?
Listen, you're absolutely right. The psychological impact, the mental health distress that's being caused to nurses right the way around the world it's huge. We did a survey last year of our associations, 130 associations around the world. More than 90% of them said that they were extremely concerned about the mental health of their nurses. They were receiving reports from nurses, regularly receiving reports of distress, of harm, of mental health pressures. We called it the mass traumatization of the nursing workforce back then. And some people said to me, you're overplaying that a little bit. And I pointed to the evidence that we have, and I continue to point to the evidence that we're seeing and believe that that is an accurate way to describe what's happening. And there's a spectrum of issues, Mike, as I think you were alluding to. There are nurses who are exhausted, shift after shift after shift, the intensity of the work, who are reaching, burnout and need some time out, suffering from some anxiety. And I'm not underplaying any of that because those are really significant issues. but there is also a spectrum that takes us through. We've had a few reports, very, very tragically, of nurses who've committed suicide because of the pressures that they have been under. We know both in, and these examples I'm going to give you aren't just limited to high income or low income countries, examples of nurses being verbally abused and physically attacked. A nurse who had chlorine thrown over her because people were scared that the nurse was a vector for the disease. Nurses struggling to access childcare, not being able to renew their tenancies, coming off shift and having anti-vaxxers hurl abuse at them as well. It's all fake. And then, you know, when we see those pictures of health systems that are clearly collapsing under the strain of COVID, we've seen them from India, for example, from other places, and we hear the stories of, you know, not enough equipment, ventilators or oxygen, and people queuing up, and the inflated prices. That shortage of basic equipment isn't the result of decisions that nurses or healthcare workers have taken, but they are the people who have to look the patient, the relative in the eye, and make the decision about who gets a bed, who gets the ventilator, who gets the oxygen. That pressure, and the moral and the ethical decisions that they are having to make, those life and death decisions, that's not what they signed up for. That's not a position that they should be put into, but it's a result of this lack of preparedness of our health systems. All of these pressures, the complexity of all of this, we haven't even talked about long COVID and the numbers of nurses who will suffer from long COVID and need to take time out. Add to this the absolute critical importance, in my view, of investing in our healthcare workforce. We're 6 million nurses short. We think that will increase as a result of the pandemic. The world is not doing enough to educate the next generation of nurses and other healthcare workers. You know, I've said it before, and others have said it as well, but you know, what are our hospitals, our clinics, our health facilities if there are no nurses, doctors, porters, cleaners? They're empty buildings. They're empty buildings. Our health systems are people, and I think that not only rebuilding our health systems, but building back stronger, cohesive, safe societies and communities. It's not just about nurses, but nurses are absolutely there as a central part. I've been talking to nurses in Myanmar and Afghanistan recently as well, and the different contexts, but the courage for those people to deliver care in some of the most difficult and challenging situations. But again, I think it then speaks, Mike, to the changing image of how we see our nurses. Would anyone want to stand up and to go and be a nurse or a healthcare worker right now in those two countries that I mentioned? Would you have the bravery to be able to do that? But I can tell you there are tens of thousands of nurses, overwhelmingly women, who are doing just that.
I was in Udon Thani, Thailand, when COVID entered Thailand via Myanmar. And of course, poor Myanmar going through a revolt, teenagers training to do battle with the military in the jungles, issues in Thailand. The king wants to commission his own personal vaccines to 70 million people. Oh my God. I talked to my friends at Bumrungrad Hospital, because that's staffed by 50% NYU trained American physicians who are going, this is unthinkable. I guess I was talking with the head of pediatric cardiology at Children's Hospital here in California. Brilliant guy. And he said, yeah, I learned just this morning that if you take your child in search of a pediatric ICU in Texas, you're told There are no beds. Go sit in the waiting room, and in all likelihood, you must wait until a baby dies. And I kind of said to myself, what horror movie are we watching? So I know what you're doing is hugely, hugely important. Let me segue a little bit. What will be you have the Congress coming up in November. What are going to be some of your themes, and will they, how do you prioritize all the things we've talked about, from fundraising to, and by the way, at a later point, I have some thoughts for you on that. Psychological implications, the idea that some nurses are actually doing lucrative signing bonuses to move from one hospital to another hospital. Sounds like soccer or something. What will be your agenda at the Congress, so that we can have a little bit of a tip on what that's going to be? And number two, do you have in your head, I think you know what the assignment is ahead. I mean, when we do television shows for national network here, we know what it costs to do a show, to make a program, to do all the technological things, and we budget accordingly. Do you have any kind of figure, either a bulk figure or a graduated timeline figure, adding to it to get the job done that you need to get done? Because I don't see COVID leaving anytime soon. I am seeing 2022, most of it, unless we get very lucky. I see this is going to be the nursing profession's finest hour, and probably the most difficult hour.
So let me just say something about our Congress first, 2nd to the 4th of November, virtually this year. I don't think that we've done a very good job at prioritizing, because I'm currently looking at more than 1,000 hours worth of content over that 3 days. Look, we've got some phenomenal speakers. We're going to be kicking off with a session that Helen Clark, a former Prime Minister of New Zealand, is going to be chairing. Helen led the review that WHO asked her to do of how the world had responded to COVID, lessons learned, what we need to do for the future. Helen was great, because as part of that review, we facilitated a conversation between her and a load of nurses from around the world. And then she included what those nurses had to say in her review. She's going to be joined by Maria van Kerkhove, who people will know as having sat next to and continuing to sit next to Dr. Tedros. So there's a lot of issues about the learning from COVID. People, I think, often miss that actually it was nurses who early on were talking to each other right the way around the world. We tried to facilitate some of this sharing, because remember, we didn't really know what COVID was, what effective treatments were as well, and were sharing a lot of their learning early on to improve the care and the clinical outcomes for people with COVID before we got the vaccine. But from that learning, these big questions about what do we need to do to better prepare in the future. So many of our health systems were caught unprepared in terms of not having plans in place, not having equipment, not having the workforce. So that's going to be a big issue for us. The vaccine inequity that we're seeing in terms of the availability of vaccines around the world. I know I've said that it looks to me like the world's lost its moral compass on this one. 80% of the vaccines that have gone into people's arms have been in high income countries. In Africa, as we talk now, still less than 2% of vaccines delivered. Nurses going to work today in some low income countries having not been fully vaccinated, and all of the risks that we've talked about that presents to them as well. So there are some big moral questions and ethical issues in here as well. The rights issues, we touched a little bit on some of the political hotspots around the world, but this again isn't the infringement of rights of healthcare workers and of women is not new. We've been engaged in work with other organizations looking at in historically situations where there is military conflict and interventions in countries, how health systems and health staff are often deliberately targeted as part of military strategies. The protection and the promotion of rights and gender inequality issues are really big on our agenda, as will climate change be. A lot of people say to me, what's this with nurses getting more and more involved in climate change? Again, are you overextending your reach here, they say. And I say, nurses see the impact in their practice with people, with patients. Every day they see the impact of climate change, whether it's heat extremes, whether it's mental health pressures as well. Arguably, climate change is an even bigger threat to the world than COVID. We're looking at some of those issues and all of these fundamental issues about what we need to do to invest in nursing jobs, nursing education, nursing leadership, but to try and make that argument for nursing, Mike, in a way that isn't just, oh, do it for the nurses because they're good, kind people. You need to do it to have strong health systems. You need to do it to have strong economies. It's not a cost, it's an investment. You need to do it so you can go for a walk in the park and we're not all locked down and our personal freedoms are restricted. And if I point to those political hotspots, those trouble spots that we see around the world as well, nurses are playing a huge part with other healthcare workers in creating peace and security within communities as well. And that's my pitch and what the international nursing community is trying to do to make sure that we see the hard cash and the hard investment. I think it'll be helped a lot. If we saw more nursing leaders around those top tables when some of these big decisions are taken. Again, the traditional view of nursing, they're great deliverers. We've got a health problem, put nurses in there. They'll manage.
Yeah.
Exactly. They'll manage. We need a vaccination rollout program. They'll go out and they'll manage all that. Yes, they will do that. But your vaccination rollout program needs to be designed in the right way that it will deliver. And you need nursing input into the design decisions as well as the delivery decisions. And many countries around the world could do much, much better at making sure they're getting nursing advice in at top level political and policy decision making.
Looking to the future, Howard, as best we can, and I realize those of us trying to crystal ball what's going to happen to nursing never could have anticipated what has happened in the last couple of years. But can you touch a little bit on what some of the expanded or advanced roles internationally are about to become for the nursing profession? And parenthetically, what is the future of nursing as you see it?
So we are seeing nursing advancing their roles in a whole range of specialisms and a whole range of settings. A couple of examples, Mike. If you've got a long-term condition, perhaps you might have diabetes, you might have heart disease, perhaps you have cancer. For many of those people, the clinician who they will see most of, who will be with them along their journey, who will be advising and supporting them on how to manage their condition and their treatment options, will be the nurse, the specialist or the advanced nurse. And patients who have that support from advanced or specialist nurses rate very highly the advice and the support that they give, have no questions about the quality of care, find that they're getting greater access to care and feel more in control of their treatment as well. You go into some rural and remote settings, we put case studies out, nurses who are providing a one-stop shop of services. They may well be the only healthcare professional for miles people come to them for, of course, immediate first aid type care, longer term worries about chronic conditions they might have, support with maternal and child health issues, mental health concerns as well. So nursing can provide very specialist care, or they can provide a breadth of care, but what we're also seeing is nurses who are also working in a range of settings. People often don't think nurses who are working in prisons, who are working in supermarkets, who are working in housing centres, who are working on the street with homeless people. And when you talk to nurses who are working with homeless people, yes, they are supporting their healthcare needs, but you very quickly find that they're also helping people who are homeless to deal with mental health issues, to deal perhaps with drug or alcohol issues, but then how they recover from their health to manage to get a job, to find a home, to move on with their life. So they're working across a whole range of sectors. These nursing solutions, effective in terms of the quality and the safety, but also in terms of the cost. I think these nurse-led models of care have the solution to a lot of our healthcare needs in the future. We should be looking at not only growing the roles, but growing nurse-led services where the team providing care is led by nurses. But to get people to start to think about that care, you need to have the nursing advisors saying, look, here's a solution. ICN tries to do that a bit, but you need it in your local health system, your nurse leader, at the top table saying, look, I can bring forward a highly effective nurse-led and cost-effective solution as well. I think that where that happens, it will lead to stronger, strengthened, more sustainable health systems as well. And I think that we see a lot of our multi-professional colleagues who are supportive and recognize the value of supporting expanded and growing nursing roles. The one thing that I would say, though, just as well, I do think that we're at a pivot point where there's a balance here. There are people who look at the nursing profession right now and absolutely, if they're looking for a career or a job, which means that they can make a difference to people every day, nursing's the profession for them. And we're seeing people who are being drawn to nursing, which is a great thing. But we're also seeing nurses who are in the profession who are burnt out and who are leaving. Some people who are looking at nursing and thinking, I see the pictures on the TV. It doesn't look like they're really being supported to do that job. I'm not sure if I do want to go into that profession. If we don't make the case for the investment to bring new people in, to support the people that we've got, if we haven't got nurses, what will happen then? It will then be down to us in our roles as friends, family, spouses, parents, to take on more and more of those caring responsibilities. And the ramifications for that, for our economies, are huge and fundamental. The pandemic has shown us how intimately our health is connected to our economic, our health and well-being is connected to our economic health and well-being as well. And without nurses, I think that you'll see that unraveling as well. I don't want to paint that negative picture, though, because I genuinely believe there's a very optimistic and bright future, and it's nurse-led, Mike.
I think that ICN is tremendously lucky to have you as its key mentor, and I'll be anxiously awaiting your November talk. Is there anything that I haven't covered? We've gone over a lot of territory here. Anything you want to add or anything you feel you want to kind of get out there before we conclude?
Listen, Mike, I thank you for the opportunity again, because to be able to put some of these nursing issues, on the table, to debate them in the way that we have, I think I'm with you. It's exactly the sort of conversation that we need to have. My message always there's always a message to me, to my fellow nurses, because I know that it can feel some days very lonely, very on your own, unappreciated and not supported. Lots of people are saying thank you. Of course, I say thank you to my fellow nurses, but I also say that I see how fellow nurses come together in solidarity to support each other. They're part of a 27 million strong family. I believe they're part of the best profession in the world. Never forget that, but also know that ICN, along with the national nursing associations that I work with right around the world, are 110% determined to follow this through to improve the investment in nursing education, nursing leadership, and nursing jobs. You know, applause without action isn't good enough. It's unacceptable, and we're committed to try and improve those issues for working nurses everywhere.
Well, I speak for Hardeep, but I know he echoes this. We are here through all the resources we have to help you every step of the way we can, because getting that messaging out is hugely, hugely important. But it's not just getting the message out. We believe absolutely in the message you're conveying. So we wish you Godspeed with Angels of Mercy, and looking forward to November. And just tell it like it is, my friend. Okay. And we will meet up at some point soon. Thank you so much for talking with us on Global Health Talks. It means a lot.
Thank you so much. And I will look forward to meeting in person at some time, hopefully not in the too distant future.
Absolutely. Thank you.